Morning, guys. Many times we discussed about each hair transplantation patient is different. Each person has a different scenarios of types of baldness and different types of treatment modalities. It happened to see a patient who had never done any FUE. Mimics like as if he has done a FUE. Once we see the donor area, we just asked him ready to do the transplant. So, kindly watch this video to understand what are the different types of uniqueness or kind of different scenarios in hair transplantation. So this is one such case happened to see actually last week. I really wanted to bring to your notice in such cases what kind of precautions we're going to take during the surgery. Actually, when we harvest the graft from the backside donor, when you shave it, it tend to show some kind of a emptiness or kind of a, if a best surgery is not done, it looks like a botched transplant. That's a quite commonest problem we see in the donor area. Well, this patient had never done any transplant, but yet the backside donor mimics like as if he has done a FUE. You can see in the video and the pictures. Initially, even I just confused myself that probably has done a transplantation, but on close examination, transplant was not done. No one has harvested the grafts. Even patient has given the information that he never been any done any FUE. Even on close examination, we saw donor has been not touched. But why it is looking like this, as if someone has done a transplant there? So that's the main question here came to my mind. So on close examination, we found that his hairs are a little straight. He made a little buzz cut where the skin is seen more, and also it's kind of physiological, little elevated skin in that both areas, mastoid regions, which is mimicking like as if he has done some harvestation in that area. So, why it is most important is on close examination during the consultation, all these points to be definitely noted and has importance for your treatment plan, treatment modality, and how you're going to execute the transplant. Because in such patients, if we harvest even normal number of grafts, not even more number, I'm sure he's going to get a bad outcome in the donor area or unbalanced donor. So that's the reason one should really observe well, examine well under bright light before taking to the procedure what kind of changes has to be done for him. Here, we need to limit the harvestation of the grafts in that area, which is already highlighted, which is shown in the picture. Actually, those two areas, both right and left, we have to harvest very less number. Otherwise, you would end up in very unbalanced donor, which is not going to be good for the patient. So these are the few factors in each and every patient. Especially in this patient, it's about only donor, but at times it goes to the recipient area also. Some people have a ongoing hair loss. Some people have a frontal of forelock. We think it is permanent, which is not. All this to be taken into consideration before making a tailored plan to any patient. This is one kind of a unique patient I came across recently. If at all, if I'm going to plan surgery to him, I'm going to avoid harvesting those two areas so that to leave a balanced donor for the future for a illusion purpose also. And most of the time, most of the patient will also ask me, they'll share some photos without hair. They'll be maintaining kind of a short haircut or a buzz cut. Such people, we really cannot observe the complete baldness, and we cannot even suggest better options. And that is the one reason one should not shave and come to the clinic or even online consultation, whatever it is, because surgeon will not get any idea what extent you are having a baldness and what way we are going to do transplantation. Because transplantation is not a substitute for the lost hair. It is a kind of a camouflaging technique with kind of few plans. We are going to give you a coverage, best coverage. So that's called camouflage. It's not the replacement for the complete lost roots. In such scenarios, during the transplantation also, we have to see with hair, and during consultation also, we have to see with hair. If you trim your hair and come completely, it's like we are going to lose a root map. My point here is when you come for consultation, with hair, without hair, with hair makes good sense to surgeon to understand the extent of the baldness. Suppose if you are going to shave it, we will not get idea what kind of baldness you are suffering from, isn't it? The same scenario implies to this patient. When you come without hair, imagine this patient donor is as if already someone is harvested. If you come with completely shave, we definitely miss this point, and probably we'll going to harvest more grafts there, and it ends up in a unbalanced donor. That's the reason when you're consulting your doctor with hair, that really makes a best suggestion for you, best plan for you. Otherwise, we will lose the overall idea and look same for us, isn't it? Hair transplant surgery it's a cosmetic or aesthetic surgery. If a surgeon is not only experienced, I'm sure a best observation, skill art, and sculpting type of hands, and kind of vision, how you're going to look at the future, all this to be accountable. Otherwise, your transplantation results may not be that great, because surgery just accounts for only 50%, other 50% aesthetic sense. How are we going to plan it according to the patient age? All this really matters. That makes the difference between you going to a best surgeon and amateur surgeon or technicians. That's the importance of getting consultation with the expertise person to get natural results.